And so we have a lot of these conditions that come in, like concussions are one of them, of course that's what we're talking about here today. But these things that come in that we're saying, well, they couldn't find anything. So they said, go sleep it off, or, stop doing what you're doing and give it a couple weeks, and, and then they come back and they say, actually you kind of got worse. Now I've got brain fog, now I've got worse headaches, now I can't really, track a ball, or I can't, I can't read very well, I'm getting dizzy in my head, I'm actually getting dizzy when I stand, and, just all kinds of things. But also feel free to ask questions at any time, just interrupt me and raise your hand, whatever. And so what we look at is, we look at these patients and we say, medical neurologists really aren't treating them. They're just, I'm in Portland, obviously, they don't even take these patients because there's nothing they can do, because there's no medication to create neuroplasticity, there's no medication for concussion, there's a few medications for headaches and migraines, obviously. But aside from that, what do? Well, that's when we have to look at things from a little different perspective. We have to look at them functionally. Functionally really means, how is the brain working? How well is it working, and how well is it connected? And so in concussions, one of the main things that happens is that we have disruption in these connections in our brain. And these connections, called synapses, bundle together to create what we call neural pathways that connect different regions of our brain together, and they connect our brain also to our body. And so if these are disrupted for any reason, then we're going to have symptoms. Okay? Think of these things as just roads in the brain that are carrying information from one area to another. And you can have the best packing plant up here, but if it doesn't get to the location in a timely manner, then it doesn't matter, right? It doesn't matter how well this is doing if it's not getting here. And so one of the major issues with concussions is that it's the disruptions in these pathways that occurs. And that's what creates the majority of symptoms. Yes, we injure the brain. Yeah, the brain is injured in general. Our gray matter is more external in our brain, and the rest of it is white matter. White matter, as you probably recall or already know, are the connections. They're the things that carry the signals. The gray matter are the cells or the neurons. Okay, and so when we injure our brain, it heals. And just like a bruise, think about it like a bruise on your arm or something. You're going to see it for a few days. It's going to hurt for a few days. And after a while, the inflammation that presented itself to help heal is gone, right? And so then we say, okay, when my arm heals after a bruise, it goes back to normal. When the brain heals after it's been bruised, it doesn't always go back to normal, because these pathways are these neural pathways that are connecting these parts of the brain. If they're not stimulated, they become weaker. And what happens sometimes is that if the brain is inflamed long enough, and it may not come back to its normal state. And then, we're kind of doing the whole presentation. This is a good intro, I hope. When we can't get those connections from one place to another because we have damage to those synapses or those neural pathways, or they just became weaker, then we reroute the information. Think about this like your GPS in your car, and you have to be here at exactly 3 to give this presentation, and if if there's a big backup traffic, or there's the bridge is out, or something to this effect, and you're late, because it reroutes you, but you're 20 minutes late. And it's like, sorry, we all know, So that's what happens in the brain, is that the information is too slow, and it gets there too late, and that's what creates these symptoms. That's brain fog, that's slow processing, that's oculomotor tracking errors, that's convergence issues, that's pupillary, people talk about light and sound sensitivity. What is that? Or light sensitivity. Well, you can't constrict your pupils well enough because your sympathetic system is in overdrive, which dilates your pupils, so you can't constrict against that. Okay, so that's just an aside, but it's very important because when you look at these people, these are the main symptoms you're seeing: dizziness, lightheadedness, headaches, brain fog, dysautonomia, which they're not saying, but dizziness when they stand up, all these different types of things that are really, really the foundation of what happens with a concussion. And the post-concussion syndrome, I mean, the research, you'll see one research study that says 30% of people have post-concussion syndrome, and you'll see one that says 15, one that says 25, one that says 20. I will tell you that probably most people have it to some degree, and they just kind of compensate, and work their way around it. It's not until you feel better that you're like, wow, I didn't realize how much I was compensating. Sometimes we'll throw people in the deep hyperbaric chambers, pure oxygen deep hyperbaric chambers. We'll do 20 or 30. Here's an example, me doing hyperbaric, right? So I started doing the deep hyperbaric, and I had concussions and played sports and a couple of bad concussions. And I've done like 20 of these sessions, I'm gonna try to get to 40 to 60. But I'm like, man, I had no idea how crappy I was feeling until I started feeling better. And I was like, dang, what's this like for I know this for other people, but I'm on the other side of the table usually. So it's very interesting because people, I get a lot of patients that are chronic post-concussion syndrome. They've had this for years, 6 months, 2 years, 5 years, 20 years sometimes. People come in and they're like, I don't know if you can do anything, but this is what's going on. And so we look at it and we say, yeah, we often can, and we just have to figure out where those pathways are originally disrupted, and then as we retrain those over time, it's going to take a little longer the longer you've had it, those rerouted pathways start to disappear. It's called synaptic pruning, or synaptic armorization. So pathways that are not needed, if you don't use it, you lose it. Well, the brain wants to do the right thing for you, but if it can't do it, it has to find another way. But if you can teach it to go back and do the right thing again, those alternate pathways become less useful. So the brain says, you know what, we're just going to cleave them off. Kind of like, a macrophage eats a bacteria.